Welcome back to Finding Common Ground with Heather and Steve. Today we are going to talk about something that's been on the news a lot recently, which is kind of exciting because this is something that we've been trying to raise awareness levels on, and it just hasn't hit till now, but now you'll see it on every channel. It's in the newspapers, and we're going to break down the situation happening in specifically New York State, but I'm sure other states are struggling with group home placements too. There's different kinds of group homes. We'll talk about all the different residential options, but I think today a lot of our conversation will be around people who need a lot of support and supervision, more for the complex individual with different kinds of needs than some of the more low support needs folks that maybe could live in an assisted apartment or something along those lines. So Steve has talked to us about this a few episodes where he has his foster care kids in his house, and he had a certain young man that was aging out of foster care. And I'll just pass it over to you because this is a situation that so many people face. And luckily, he had you in his life to help him navigate this really difficult transition.
Yeah, we had a 20-year-old that was aging out December 11th. And what happens is it usually goes to the county and usually goes to the provider agency to try and come up with some kind of transition plan. But there really isn't a transition. It's more of what are we going to do? And there's nothing in place. Now, normally when a kid ages out, they normally can go just get a job. Coming out of foster care, they can just go maybe live with a relative, maybe go live with a friend, maybe go in the military. But in this particular case, or anybody coming out of complex care that has complex needs like mental health issues or autism, which was the case with this gentleman, there is nowhere to go, and there's no transition to somewhere else. He has to go into a group home, or he has to go into a supportive apartment, and they're just not there. And it took quite a undertaking trying to get him somewhere. At the very last minute, we got the miracle, and he moved in yesterday. It doesn't happen without a whole lot of things happening behind the scenes. It just wouldn't happen. Fortunately, because I'm so involved in advocacy, I had some ideas and ways to go. A lot of parents don't have that, Heather.
Mm-hmm. No, I agree. I was just thinking, you had said something a few weeks back about how if somebody's in foster care, they can't access all the same services. And it reminded me of the people who are in a nursing home. If you have somebody with developmental disabilities and they get placed in certain settings, they can't access all the same things as if you were in the community. In a nursing home, I guess it kind of makes sense. They're spending so much money on that placement. You have doctors and nurses, and so you're not going to your day program. You're not having all the OPWDD services that people in the community would have. But it just astounded me that people in foster care that are in this really fragile, volatile situation, that they don't have all of the services pushed in and ready for them right from the start. You wouldn't think that you'd have to scramble. If we're removing you from your parents because you're in a dangerous situation and we're saying they're not doing a good job, we're going to take over, then we should know what we're doing and we should have a really definite plan. That's not robbing them of the services that they would have got if they stayed at home with mom and dad. It's crazy to me. So he's approaching his birthday. You work with, different organizations and agencies. And from what I understand from what you've said, nothing was lined up. And he couldn't just move out. So it sounds like it was a matter of you knew what to do. This isn't something you type into Google and figure out. So, what are some of the steps that you took?
Yeah, look, when they're in foster care, there's case managers, there's case planners, there's case aides, there's therapists, there's health homes, there's multiple outside provider agencies sometimes that deal with community waiver services that push in while they're in foster care. On their 21st birthday, all of that leaves. Every single program leaves. There is no fallback. There is no transition to an adulthood type situation for these same kinds of programs that he still needs. There just isn't, and it's very very unfortunate. And this child's not alone. This happens quite a bit, and the more we see on the mental health piece, and the more we see on the autism piece and the complex care with the dual diagnosis, I think you're going to see more and more of that, and I think you're going to see more and more situations arise like this where they don't have anywhere to go.
And you have to assume if you're in a scenario where you have autism or another developmental disability, you're already different, right? You already stand out. You might not fit in. You have some gaps there that you need extra support in. Then you add in the trauma of being removed from your family home and possibly bouncing from house to house, like you've been in multiple settings. And for somebody who needs that familiar, predictable schedule, moving out of a family home is really, really hard in the best case scenario for that group. Like you have to plan it. Lots of times parents will go buy a house or have an apartment set up, and the person visits once a week, and then they visit twice a week, and you build up gradually. But in the foster care scenario, Steve was not allowed to keep this young man in his house. When they age out, he would have been liable. He would have been in trouble to say, I'm just going to be a good human and I'm going to let him stay here till we figure it out. That really wasn't an option. And lots of foster care parents aren't going to take that chance because it could, mess up an adoption that they're working on, or the agency's not going to place anybody else with them. And God forbid something happens to them during that time when you're not supposed to have them at your house. So that's a situation that I give you a lot of credit for, because you navigated it, I think, with some grace. You didn't, I don't know, maybe behind the scenes you were a little upset and frustrated, but this is happening for people who aren't in foster care too. But if you're at your family home, there's not that urgency. Mom and dad aren't going to just kick you out at 21 and you have to figure it out. But here it's like you get dropped like a hot potato and you're supposed to just all of a sudden know what to do.
Yeah, he wound up going to an 8-bed nonprofit. I want to call it more like the old ICFs and IRAs type situation. I feel good about where he's going, but again, you just don't know in the grand scheme of things when you place a child or you place an adult in a group home or any kind of these settings when you don't have any oversight. And we are looking at some guardianship situations now, filing some papers for that, so he has somebody to can help him with some supportive decision making going forward. But we're not there. He's 2.5 hours away. We're not there.
That's so hard too. You can't go visit, make sure he's okay.
Right. And like I said, we're not alone. There's a lot of families dealing with this, and there's so many. I mean, going back to the news story, if you want to elaborate on that, Heather, some of these things going on in the news right now is why I worry about placing a kid that's been in my home for 4.5 years into an outside setting.
Yeah, that's a good segue, because there's been a couple things in the news that people probably have seen. The first story that broke had to do with the Anderson Center, and that's a children's center for people with autism. And the governor in New York State actually had just given them a huge, millions of dollars because, rewarding them for doing a good job. I preface it that way because sometimes on the outside, these facilities, they look great. They have that, the lawn is manicured, the house looks great, there's a ramp on the outside. But it sounds like, even though this facility is very well known and respected within the community, that there's some things happening behind those closed doors, right? There was a young man who was living there, and his parents, he's minimally verbal, which means he's unreliable. He can say a few words, but he's not going to be able to describe things in great detail. And that's a hard position for families because he could say, ouch, or I hurt, but you're not sure what hurts or if someone hurt him. So this family, they felt like things were okay at the Anderson Center. And then they had a staff member call them. And he said, I need you to come here because I need to show you a video of something that happened to your son. And they went. And they had no idea what was going to be on this videotape. And it's very graphic. We can add a link to the news story in our description for this podcast if you want to watch it. I do caution you, though, because it's very upsetting. A staff member, you don't see what leads up to it, but from what the witnesses had said, this had been going on for about a half an hour, where he was trying to control this young man and get him to his bedroom. And I don't know why, but that was the goal. And for whatever reason, that wasn't happening without this man putting his hands on this young man. So he grabbed him by the genitals. I'm just going to say it. And he dragged him across the room. The kid is screaming. He is screaming in pain. People in the house are backing away. The images are all blurred, so you can't tell who's in the videotape, but you can tell the reaction is surprise and shock. But no one steps forward and no one stops him. So the family watches this video and they call the police. Which they should, right? I mean, like, if anybody else was attacked in that way, we would call the police. Unfortunately, a lot of times, at least in the state of New York, the police are very limited in what they can do. And the article that was written about this was so well written because it said that without video evidence, they probably wouldn't have been able to do a thing, because they would have questioned this young man and his verbal abilities would have been very limited. He wouldn't have been able to explain what happened. And the other staff members, fearing for their job and fearing that, that would become even a more hostile work environment, might say nothing. And that's what happens most of the time. So I feel like that's something for us all to think about, because I don't think anybody wants those things to happen, but for whatever reason, people are likely to turn away and not acknowledge it a lot of the time. But one worker in that house did. He pulled out his camera and he recorded the incident. And instead of showing it to his employer, he showed it to the family. And that was his one little thing, because I'm sure he wanted them to know, right? And who knows if they would have ever seen it. But he didn't get whistleblower status officially. He didn't follow the proper procedure. He told the family instead of his employer. And what happened was he was here on a work visa. They pulled his visa, they fired him, and he could get deported. And it's just insane because he did the right thing. Now, I don't know this man. I don't know what his story is. But the fact that he reached out to the family gives him some credibility to me. He didn't post that online. He didn't go to the police or, go to a reporter and try to become famous with it, right? And have his, fame for 6 seconds or whatever. He let the family know that their son wasn't safe. And that was really brave. And I wish more DSPs and caregivers in those situations felt empowered to do those kind of things. Which brings us to the big topic. Because the police officer said that they could have done nothing if they didn't have that video evidence, why don't group homes have cameras?
I think
it's mind-boggling, right?
Yeah, look, I think there's a lot. It's complex. If I try to put myself in other people's shoes, and if I were to put myself in the shoes of maybe some workers there, especially if there are unions there, I can see why they probably might not want to be on board with that. I still tend to agree that there should be in common areas cameras, period. The cameras are everywhere we go now. You can't even walk down a street and they're in lights and everything else. So,
that's how we found the shooter in New York City, right? They followed him on all the cameras. They were able to track him down with security footage. But for our kids, they just don't have that same benefit.
Unfortunately, I think that there's such a kickback to the camera thing, and it just gets a bad name. And I don't know why we can't get around that. I think to find common ground, so to speak, we need to get everybody at the table and find a way to get the cameras in there and find a way to make it work that
Right.
appeases everybody in that group home.
Because they'll say, like, it's against their civil rights. And I think, being abused in my house is probably breaking my civil rights too. And if I can't describe it and that person who's abusing me doesn't get punished and there's no consequence, then how is that safe? So if you're in a hospital, there are cameras. If you're in a school, on a bus, if you're in a store, if you're in a nursing home, we keep our cars safe having cameras all in the parking garages. I don't know. I mean, the governor actually even mandated cameras in homeless shelters. And her quote was something to the effect, we want people to feel safe in their home, even if it's just a temporary one. Okay, so group homes, people live in them for years, decades sometimes. This is their home. They should feel safe there too. And if we want to empower them, if they have a guardian, the guardian can say whether or not they're okay with the camera, right? If they make their own decisions, they can say that. But when I worked in that nursing home and we had over 100 cameras in our facility, we knew we were on camera, and it did change things sometimes. And it's not to incriminate people. A lot of times we would say, oh my goodness, look at little Ethel came out of her room and was razzing him, and that's why he had a meltdown. It wasn't the staff member being late with his, food tray. We would think we knew what the answer was, and then we watched the video and we thought, we just didn't have all the information. Or if there wasn't a time when somebody was injured, we could see the beginning, the middle, the end, and all the people who were involved. And that helps too, because the people who observe violence are traumatized too. If you're living in an environment where someone's dragging a young man around by his genitals, you have to be scared. You have to think that could happen to me, and I'm not safe. And living in a place where you don't feel safe and heard, that's the most traumatizing thing, right? I mean, that's like a hostage situation. They don't have the voice, they don't have a way out, and no one's listening, and no one's coming in to save them. I'm sure the police officers, when they get called, they want to help. But Steve, I wonder what your opinion is on this. They arrest one person, that I'm sure that guy got fired, right? The person who did it, there's no denying in the video that he did something highly inappropriate, criminal. He might have charges against him. The setting that allowed that to happen is still there. Systemically, the issue hasn't been solved.
And I don't see it changing just off of that either, because it is systemic. Just so the audience knows, in transparency, Heather and I are both part of NIAD, which is the New York Alliance for Developmental Disabilities. And for several years, we've had meetings about these cameras. There's been groups put together trying to make it happen, and trying to figure out how we can go forward and trying to make something happen. And all we hear is story after story after story from parents who are worried, just like I would be, with somebody, somebody new or somebody going from my home to somewhere else, or any parent bringing their child into a group home or, a setting that's not their home. And I can't imagine not trying to find a way to come up with some solutions to help those families, because, like I said, we hear it all the time.
And DSPs will say, the families aren't showing up. We're so overworked. We're undervalued. And I feel that for them. But they might not realize, like in your scenario, that he was placed 2.5 hours from your house. You can't go every day and make sure he's okay. You can't offer him that support because he's not down the street from your house. He's miles and miles away. And I feel like if the staff and the families were more connected, this would be better. But it's a medical model. And they're not supposed to call up and say, hey, by the way, we've all been here, for 24 hours and we're shot. You should probably come and get him because there's nobody safe to drive him to his appointment. But that's the situation that staff are in. They have to make a decision. Okay, these 6 people are supposed to go to program, but, this lady over here, she's been up for 32 hours in a row and she's really tired and she's saying she can't drive. And then this other person has, a doctor's appointment and the staff are trying to make it work. They're not bad people. They're really, really good people, but good people break and they get burned out, just like the families. And we can circle this back to the people who are on wait lists. Those parents don't have a team of staff that are working with them, right? They don't have those supports that are available in a group home setting. It's just them. And some of these families have been on wait lists for 10 years, 11 years. One woman in the newspaper said she had been on a wait list for 15 years for her daughter, and she's in her 80s. People are just desperate to find a placement. And like you said, they could end up hours away. But how do we know once we get them in that they're actually safe? We're like fighting to get them somewhere. And like you said, and you're like, oh, I just hope it was the right place. I hope the staff take care of him.
Fortunately, with this particular young man, I went down there, and I actually serve on several committees with some of them, so I'll kind of be able to kind of keep tabs that way. I do feel comfortable with where he is because I think they've got a good reputation, but it's obvious that it could different. It'd be something different because, like I said, other parents are coming across to us in some of these NIAID meetings with something completely different, that they're worried about their children in their group homes, and it's telling us specific things that are going on. And I think the answer is to get everybody at the table, including the DSPs, including OPWDD, including the parents, including the provider agencies, all at the table to try and hash out how can we get a camera on board in this facility that works for everybody involved, and use that approach over trying to. I don't think we're ever going to get it through pushing it through adversarially, because there's always going to be somebody trying to block it, in my opinion. But I think if we can get everybody at the table, I think there's a better shot at it, and get everybody's opinion and respect those opinions, and on what's your reasoning for not wanting one, and what's your reasonings for wanting one.
Right. I would think that in the state of New York, you can do an audio recording, and it's a one-party state, which means as long as one party knows they're being recorded, it's okay. So I know of one particular local mom in Rochester. She knew her son wasn't okay, and she put a recorder underneath his bed. And she picked up horrifying information. She was shaken by it, so much so that she moved into the group home with him. She wouldn't leave. They kept saying, "You're not allowed to live here." And she said, "He's not safe. He's not safe. He's losing weight. He's having medical events." He kept ending up in the hospital. And she collected enough evidence that she could share it with the state, and they shut down the group home. Now, that's not our goal. Our goal isn't to shut down homes, not when we have thousands of people waiting. But we need to shut down systems that aren't safe. And we have to start rethinking things. So maybe you put the recorder in your child's room. Maybe you break the law. It's not really a law. Maybe you break their policy and you say, "I'm putting a nanny cam in, and I'm going to see what's going on when I'm not there." Or you set up the iPad and you have it so that when you FaceTime them, it just turns on. I know people did that at the nursing home all the time. They could just kind of like peep in and see what was going on. That puts people on notice, but it also gives us some evidence that we can use when we're trying to change policies. And it's not to punish people who are doing the best they can. It's to say, why is there only one staff member trying to transfer this person onto the bed? That's not safe. They're going to hurt themselves or hurt the person. They can say, "Oh my goodness, if we lowered the mattress," or you can really analyze the situation when you have the video, and you can't do that without it. The audio gives you part of the story, but probably not enough. So let's say that in the best case scenario, we could have these, recording devices, and we would have this footage. Right now, what happens is the person who did who broke the behavior plan or who didn't follow, the person's life plan, they get in trouble. But why are we never looking at the state and saying, you put that employee in a dangerous situation? Some of these individuals are extremely aggressive. Some of them would have been in prison or a lockdown facility, but we closed those. We are matriculating people into situations, and you could have somebody with Down syndrome and have a felon in the same bedroom. And these staff are trying to negotiate that and figure things out. Last night, we were having a discussion with a group of parents from NIAID, and they said, these out-of-state placements know what they're doing. They're $1,000 a day, but when we send our family members there, the staff are trained. They're compassionate. They understand what the target behaviors are. They understand the approach to use. If other states have figured it out, what excuse does New York State have that we haven't? And why, if we have 250 students right now in New York State going out of state for placements, we're spending $1 million every 4 days for these kids to be separated from their families? Why can't we take that millions of dollars we spend every month and build something here? I mean, back in the 40s, when we were reimagining, it wasn't OPW then, but OMRDD, they brought people in from other states and they said, how are you doing it where you are? We didn't try to investigate ourselves and fix ourselves. We brought in the experts, and we need to do that again. If we're going to advocate with our legislators, that's what we should be asking for. We don't need to study this in-house anymore. We need to bring people in from the outside that know what they're doing, quite frankly, because we don't. We're failing.
I agree. I'm not sure what the answer is, other than we keep the dialogue going on that. I thought maybe we could spend a little bit of time on a little bit of year-end review and some teaser things that are coming forward with some fantastic guests we have coming in next week in January. But we've also had some phenomenal people on already, and I was wondering if you can rehash a couple of the ones that we have had on.
Yeah, absolutely. Because I don't know if we have enough time to go through them all, but I just think of some of the highlights. My friend Tina came on. She's an adult with cerebral palsy. She had lived in an institution, and her story describing how she went from an institution to independence. People come up to me, at the grocery store and say, that episode moved me. And I think, oh, good, because we're pushing back towards that institutionalization piece, right? Like, people are slowly getting placed back into these bigger facilities. Even when you just said an eight-bed home, that's a lot of people in one house. Most families don't have 8 people under one roof. That's a lot of people to manage, because on top of that, you have all the staff. So that's even though they could be much bigger, right? So I think Tina's episode was a great one. I love talking to Otto. He was our non-speaker who uses typing to communicate. I felt like he was really inspiring, and he just made us look at things differently. You start to realize that what somebody looks like on the outside and what's inside of them could be really different. Did you have any favorite episodes?
Yeah, I one of my favorites, I think, was the when we had the executive director for the Institute for Exceptional Care, Mia Pham. She was great. About some innovative things coming to help the disability and the waiting lists and the medical and the doctors and the dental part of all our issues that we have with all of that. And they're looking at some really groundbreaking things with that. We also were able to get a politician on, which is hard to get. We got an Assemblywoman Buttonshon on, who gave us her perspective. And I think it was very telling, and I think it was very brutally honest on how to approach her. And probably, now that I think about it, probably my absolute favorite was having a foster kid on who had aged out, Tristan, who has a compelling story in itself, because he never should have made it with what happened to him out of the broken system, and he did. And I look forward to, in 2025, maybe adding some additional kids that have aged out in foster care and future programs.
Because the stories are what tell people what's going on, right? If we can just spout off facts and data and statistics and tell you how bad it is. But when you walk through someone's life with them and you hear each chapter, it just means more. And then it feels like, well, of course we have to help Tristan, or Otto deserves this, or Tina, that should have never happened to you. And you can break it down so much easier when it's really personalized. So I hope our audience likes that format, because that's really, it's all about the stories. It's about the people. It's also about the solutions. So when we bring on somebody that is a legislator or policymaker, it also gives you that perspective of how do you get their attention. And that's what we're trying to do right now. We're trying to get some attention. We're happy the media is picking up the stories. I had 4 op-ed articles published this year. I had 0 before this year, but it's a hot topic. People are starting to listen. And this podcast itself is really growing, and people are talking about this. You know, Steve and I will be in a state level meeting, and they're talking about the podcast. And I think that's so cool that, you know, in their boardroom, they're watching the episode that has to do with the people they serve. That feels really good. And we have some people coming in from the Children's Agenda. The person who's going to be representing their different campaigns, Kids Can't Wait, and Solutions Not Suspensions. He'll be with us soon, and he's a community activist. And I think that we can learn things from each of the guests that are coming up. I'm trying to think of some of the other episodes we have coming up, because we have so many people lined up, because, you know, once we do one, it like springboards into 2 or 3 more people calling and asking.
Yeah, we have Kathy Caruso coming up. It's part of a project that we're working on. It's through Better Together, and actually the veterans who'd ever imagine that disabilities that have anything to do with a veterans organization, but we did the tie-in with it, and we're in the middle of building a complex care recreation center that's going to be really cool. And Heather's kind enough to come to that gala.
Mm-hmm.
Give a shout-out plug on January 24th for it. But it's one of the first in the state that's going to deal with specifically complex care, disabled individuals, mainly adult, who are going to have a place to go to. And she's going to come on and tell that story. And I know we're having, you said Linda and Shannon might be coming on too. They're other NIAID members. I don't know if you want to talk briefly about what they were going to be talking about.
They've been working on a complex care bill, because basically some family members are so complex that they can't go to school. And if they can go to school, they need a nurse to be with them. And you can't find a nurse to come into your home and spend 24 hours a day with your children, especially if you're in a rural area. So a lot of families are acting as a nurse. They're doing a lot of those duties because they have no other choice. But if you're staying home all day and you're helping with the ventilator and tube feeds and all the different medications, and you're doing all of those things, you can't have a traditional job. And now and just the strain of being a caregiver 24/7 is hard enough. And having a child that has a life-threatening medical condition, that's stressful enough. But now they don't have income either. So the bill that Linda and Shannon have been working on diligently for over a year, that's I would love for them to come on and talk to us about that. We had a first responder come on and tell us about that side of it, what to do if you're in an emergency situation. So I feel like the medical piece is a big deal for a lot of our families, whether it's mental health crisis. I would love to do more with mental health. There's a lot of different topics that we can touch on, and the way that we stay in tune with what's going on. NIAID Helps, that's a Facebook group. There's over 14,000 members on it. So if you're on Facebook, that's a great community. People will come on and ask a question, and thousands of people will be engaged with one post. That's how we kind of keep a pulse on, what are the hot topics right now? What are families struggling with? But please feel free to reach out to me and Steve too. If you have a topic that you're dying to talk about that you think that would really make an impact for other families like yours, we'd love to hear from you. I mean, sometimes we learn about things in the craziest ways. we bump into that person in the grocery store that saw Tina's episode, and the lady next to them starts talking to us, and I'm like, you should be on the podcast. I started putting it all on my phone because I thought, I'm going to forget. There's so many great topics. So I'm really excited. I'm so glad we did this. We had talked about it for so long. We knew that we were in different parts of the state and it would be hard to coordinate, but you made a studio right in your house, and this is working. We're cranking out the episodes and we're listening to the people who are coming forward. So please reach out to us and let us know what you want to talk about next.
Continue the conversation by joining our Facebook group. If you're a fan of the show, please join our supporters club. Subscribe on YouTube, rate and review on your favorite listening app, but most of all, share it with your friends. Just one more click or comment can make a huge difference and help us to continue finding common ground.